Mhm.
Hello, everyone. How are you? I'm Violet, your Tai Chi examiner. Today is my distinct honor to interview Dr. Helen Lavretsky, and she is well accomplished. And in the medical field, she is an MD and also a research scientist, and she has won many awards and in the area of the research and in the psychiatric area. And without further ado, Dr. Helen Lavretsky, and how are you today?
Thank you so much for inviting me to speak to you listeners.
Okay, well, I remember about 2 years ago, and at the inaugural convention hosted by OSHA Center and Harvard Medical School, and it's about the science of Tai Chi and Qigong for the whole person health. And you have made a few great presentations and talking about uh, the senior brains and then the brain issue. And also through your research, you have found out your ways and then can help seniors to deal with these mental issue. And so you want to talk a little bit about your study in the area?
Right. So I have a number of studies going on, and I have completed many studies. Some of them are of Tai Chi and Qigong. I do study, I'm a geriatric psychiatrist by training, and I'm certified in integrative medicine. I'm also a neuroscientist. So really, my research stems from neuroscience, medicine, neurology, and psychiatry. And I study neuropsychiatric disorders of aging, brain disorders of aging, and those include depression, anxiety, insomnia, cognitive decline, chronic pain, and cognitive decline going into Alzheimer's disease. I also study stressed dementia caregivers. And I use mind body interventions like Tai Chi, Qigong, and yoga to help them reduce stress, but also produce benefits for brain health, providing neuroplastic effects like brain changes, gray matter grows back, and also universally they have stress reduction, biological effect in stress, and reducing inflammation because of it. And the inflammation is like this common denominator of most disorders of aging, like heart disease, cancer, stroke, and Alzheimer's disease, depression. All of them are linked to increased inflammation in the body.
I see. Well, it seems you have uh, done a lot of study in various areas, and that's great. So, what you find is most amazing things, and the mind body and intervention um, help with any brain related issues.
Mhm. So, if we apply mind-body practices, like for instance, I've done two studies of Tai Chi in older adults with depression. It reversed depression, reduced depression, improved mental health, improved cognition, and improved resilience to stress, reduced inflammation, but also rewired brain on neuroimaging like fMRI. Many more areas of the brain are talking to each other, and this increased connectivity also linked to improvement in depression um, and stress and resilience, improved resilience to stress. Currently, I'm conducting another Tai Chi study, which is implementation trial of Tai Chi for knee arthritis pain and function and depression. And that is a four-site collaborative study with other institutions like Tufts University, Boston University, and Cleveland Clinics and UCLA. So that's ongoing. I also
Are
have
you
done
doing
studies.
that with Dr. Chen Wang? Since you mentioned
Yes,
tough.
yes. Chen Wang is leading that one.
Okay,
And
great. Yeah.
right. So, yeah.
Yeah, I had a pleasure interview her before, and the two study you already completed. You're talking about the depression, and you're talking about how the 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 how should I say the rewire the brain. Did I hear you wrong? And what it exactly means, and then how does that affect the people's behavior? And so, can you explain it a little bit more when you see people? So a lot of time I heard scientists talking about say affect the so-called executive function, but exactly what that means and um, can you elaborate a little bit
Right.
for us?
Right. So what we find is that because people in Tai Chi, they do a lot of things. They move, they breathe, they center, they position, they feel the energy, and all of it trains the brain, different parts of the brain that regulate that function. And that produces a growth in gray matter volume, which other studies have found, and also connection between different points in the brain, and better connectivity in the brain means you think and react faster, it's more effective. And also it's associated with improvement in cognition, but also what we found, improvement in depression and resilience. So if different parts of the brain that are involved in stress regulation and also executive function are involved, then you just train your brain to react more faster, more efficiently.
I see. Yeah, I recently wrote an article about so-called the gray matter and the increase because
Mm,
people, I think that study was done mostly with the subject in China, and they have three groups, and one is the control group, of course, and
mm,
the other two, one is doing the Tai Chi 24, the other one was doing the asexual brocade, which is a qigong exercise, and they found out that yes, the gray matter increase. And I remember that was probably back then 10 years ago when I interviewed Professor James Mortimer, and he did that about says how doing Tai Chi can can increase or can delay the onset of dementia. And one of the things they find out is the brain mass or whatever increase the size. And so I wrote that in one of the readers, and I said, "This is ridiculous. Does that mean the head exploded?" It's like,
No, gray matter volume increases in size, but it's not the head. It's the brain inside the head, the bone structure, skull. And, it's not huge amounts, but any amounts is better than nothing, because that preserves you from atrophy that is consistent with memory loss or loss of function. That's what happens with aging and Alzheimer's disease. So you can, by practicing this Tai Chi or other mind body practices, you can actually regrow your gray matter and prevent decline in brain size, but also in function.
so here is a like a burning question for me and also a lot of the say Tai Chi instructors. And when Tai Chi Chuan, the traditional authentic Tai Chi Chuan is not easy to learn. And then so people really need to pay attention or whatever. So I consider that as a brain exercise. It's not just a physical exercise, right? But people just say, "Oh, it's too difficult," and they wanted it to be simplified. But if the Tai Chi is too simple, does that take away the effect? And the scientists have found out and say, "Oh, okay, it actually can grow the gray matter and the reconnect, the brain and up there." So what's your take on that one?
Yes, whatever is difficult to learn, or just, it's a new knowledge to learn, is gonna help you grow your brain back, because it is an effortful learning. which, engages a lot of your brain to remember, repeat over and over again, because older adults, especially who are naive, had never experienced Tai Chi, have troubles remembering the sequence of movement. And the more movement you have to remember, the more difficult it is. Some of the Tai Chi practices are over 100 movements in sequence. So we try to simplify the number of movements up to 20 to allow people to master their Tai Chi skills. And we found that even abbreviated practices result in the same improvement in brain function and mood and anxiety, sleep, stress reduction, but also brain qualities like connectivity and neuroplasticity.
I see. Wonderful. And so my understanding is you have a book coming out, a new book coming out, right? And if you don't mind, and can I share the cover of the book with the
Oh,
audience?
yes, please do. Yes.
Okay.
Thank you for
Yeah.
mentioning it.
Oh, okay. And so can you see my screen? Can you see the cover
Yes, I
of the
do.
book?
Mhm.
Ooh,
Right. Living
okay.
from the Soul, the Neuroscience of Spiritual Awakening. And that's
Yes.
something that is based on my clinical experience and research experience, where I teach my patients in the clinic to do this soul listening meditation for 15 minutes when I facilitate this connection to the soul if they're open to it, and the majority of people are open to it. In my experience, because they come to me as an integrative psychiatrist, almost 95% of them are open to the notion of soul and connection. And
Mhm.
so I teach them to a very brief meditation. I facilitate this, and they ask their own soul questions. And for the most part, I work with people with long COVID or severe illness or memory loss. So they typically ask their soul, why is this happening to me? Why is this experience occurring to me? And then
Mhm.
they intuitively listen to the soul's answer. And for the most part, the soul answers, it comes to learn from it. This experience is given to you to learn from it, to grow from it.
So
So the
what do
book
you?
is,
Uh-huh.
yeah,
I'm sorry. So
the
exactly
book is
what is a
about that.
soul listening?
Yeah.
So are you playing some audio for them? They listen to it, or you just ask them to be
I've
quiet and listening to themselves, listen to their soul? Oh,
Well, because I deal with people who have different backgrounds, and some have not meditated too much. For meditators, it's easier. So basically, it comes to that centering, closing your eyes, breathing through the heart. I go through some steps of running through golden light and connecting to the earth, grounding, and then connecting to the sun and feeling the presence of the soul. I mean, it's a process. You just don't have 15 minutes to go through that. But basically, for people who are not used to meditation, I make it a little more relaxing and grounding, and then we connect with the soul. But basically, it's getting quiet, closing eyes, breathing, and just connecting, dialing your soul, I call it. Dial your soul, just connect.
okay. So
Ask, soul, are you
mhm.
there? And then listen for the intuitive answer, the first thing that comes to mind.
Very, very interesting. It is still well, you call it dialing your soul, right? And then this method is a brand new method, or is someone else already using the same technique or methods to work with patients?
No, it's pretty unique. I developed it. I learned the technique from a yoga teacher I studied with, Sirigian Khalsa, but I adapted it. It's shorter to a clinic. When people come from different traditions, by only requirement is that they believe they have a soul or are open to the idea of. Very few in the United States don't feel like that. And then I don't do it. I just prescribe medications, I do psychotherapy, And that's a sort of a deeper practice when you connect with your own authentic self. And I've seen really breaking barriers, kind of people are transformed by this experience very fast. And
So for what kind of problem they can solve through this talking to
pretty
the
much
dialect?
everything. Yeah. So they can answer any of their burning questions by connecting to their soul. And that's the power. You don't need to go anywhere. You don't have to pay money to anybody. There's no prescription for that. It's your own light, your own soul, your connection to your divine self that answers to your questions. So, and I actually did a neuroimaging study with that meditation, and I compared people. We had 10 people who did the soul listening meditation and also had compared it to exposure to art, digital art, very beautiful artists, Traffic and Adol, or nature videos by just National Geographic videos of national parks. And so what was the reason we combine these experiences compared is that they're transcendent experiences. When you are connecting to your cosmic soul versus experiencing art versus connecting to nature, all of it is transcendent. It's bigger than yourself. And we saw quite a bit of similarities in brain activation between the soul listening meditation, connecting to cosmic soul, transcendent meditation, and art. And it was like in the areas of the brain that are committed to processing the information, like it's a deeper processing. Um, the nature videos were a little bit just watching without much deeper understanding or deeper connection, following the processes in your body. So this just shows you that brain can respond to this transcendent experiences, and you could use a brain reflection as a biomarker of that deeper state of connecting to the soul versus connecting to art.
So let me understand better. If people done this, can they solve what kind of emotion problem, anger, sadness, or they can uh, solve some physical problem like chronic pains, and what kind of problems, and can
So
you?
yes, I mean it's such a deeper connection on a much higher level than we typically live on, especially people who are suffering are typically just living in their physical body. When you connect to the soul, you're sort of exiting just the body. You understand that there's more than the body. And this is a valuable perspective for people who are dealing with chronic medical illness or chronic pain or chronic suffering, because they understand that it's temporary, that there's a bigger, larger knowledge of the universe and a bigger aspect of themselves above suffering. It does help them understand that they also are not alone at any given time. They can call upon their soul. And people who feel lonely or abandoned or very stressed, like caregivers, for instance, many caregivers feel like they're against the wall, their lives are stolen from them.
Mhm.
By connecting to this, and that's where I started doing it 15, almost 20 years ago when I did the caregiver study. That's where I discovered the value of this meditation, is that it spared them from suffering. They understood that they're never alone. They can call upon their soul and have a conversation, and their suffering was reduced. They were different people after they did this meditation.
So, how long is the meditation? Is it 15 minutes or
Yeah,
15
well,
minutes?
the way I do it,
Yeah.
about 15 minutes. Could be in experienced meditators faster, 10 to 15 minutes. It's a little bit longer in people who never experienced anything like this. And I facilitate it, so I make it a little faster. When you get to the place of, so the point in the meditation that is valuable, like changes people's perspective, is when I ask to feel soul's hug feel your soul's hug. And that kind of is a turning point. Almost 95% of the participants who go through this meditation start crying
Oh,
at that
what?
point, because this is for the first time that they experience soul presence so distinctly.
So does that have a sustaining power that yeah, it's
We
for
have to
how long?
practice it, yes. Yeah. But even one experience kind of changed their perspective on life, who they are, how they live their lives.
So so that they can do just a 15 minutes session, and then they will never experience the same
No,
issue
I
anymore.
never
Oh,
say never for anything.
okay.
So
Sorry, I'm
it
just
like
curious.
like everything else, it requires practice, especially for people who never experienced it. What the space is given to them, and the way I facilitate it is to relax them, expand them, quiet their minds, keep their minds busy with visualizing light, and then we connect to the cosmic soul. They feel safer in that environment because I create that environment. And I mean, it's not for everybody, like nothing is for everybody, but there's certainly a grain of wisdom that they gain from this experience connecting to their soul. And again, it kind of expands their horizons in terms of understanding what they can achieve in their lives.
I see. So people should not just, or can they just practice by themselves, or they has
No,
to
not
be
what from
guided?
what I described. So, I do write in the book, I do describe it.
Uh-huh.
It is described there, but it requires just quietening down and following the cues. I use a lot of golden light, just running it through the body, breathing in golden light.
Mhm.
Um, so once you learn it, you can do it yourself. I mean, I don't own a patent on it. It's your soul.
So, so
So
does your book come with like an audio part? The reason I say that because the book is on the bookshelf. But anyway, and it, this book was it is written by a Harvard a professor, and he has both the the printed version and audio version. And on the audio version, of course, it has some kind of practice. He leads people to do the meditation. And then if for people who just have the printed version, they don't have the audio book, then they can go to the website and then listen
right.
to it. I don't know if
So
you're
it's
offering that as well.
right. I do have a website. It's drhelenlavretsky.com.
Mhm.
It's a very good point. I will place that meditation on that website. It's not there
Oh, wow.
yet, but I'm preparing for the book release, and I will place that meditation there.
Oh, wonderful. Thank you. Um, great. And then maybe later on you can give me your website, and I will put it in the article as well as down below the video. So
Mm.
whoever you're watching this on YouTube, and then you can click on it and get the important resources that way. And this is really wonderful. And so in how should I say, with all the research work and you have done, and what is the challenge of the doing this mind body intervention for for patients and how should I put it that and
Yes. So patients have to be open to it, to whatever intervention is. You have to standardize it, so it has to be manualized and standardized among the teachers who are teaching this, whether it's Tai Chi or yoga. And um, then measuring outcomes has to be sensitive to the cultural origin of the intervention, but also Western science, like we have to have Western outcomes and by administering Eastern philosophy based and Eastern teachings, traditions, mind body practices like Tai Chi or yoga. So it has to go, it really translates between the worlds. But I'm quite fluent in quite a few cultural um, practices, and I can translate. I can go back and forth. It's always interesting to me when I travel to Asia and when I present the results of the studies, the conversation that happens in trying to translate East to West, West to East.
Uh-huh.
Um, and it always fascinates it. But I also notice that a lot of the people who are living in Asian countries that have really rich and ancient traditions of these practices have not practiced them, and they're looking to me to explain to them why it's good for them. I find it really fascinating. It happened in Japan, it happened in Singapore, so what happens as a result is this exchange, and
Yes.
meaningful discussion around these practices.
I see. Very interesting. And early you mentioned the how should I say modality? You use modality, I should say, and then you use to do the research is like 22 movements Tai Chi. Is that a Tai Chi chair you use?
Tai Chi Cha. Mhm.
Oh, okay. Yeah, I know many scientists like that. That
Yeah,
form.
and I can
Actually, I also teach that as well. Yeah, Tai Chi Chuan.
because it has a manual, with pictures where everything goes. You can standardize it among teachers, but also there's a supervisory. We can supervise accuracy of delivery.
Hmm. That's very, very true. Hmm. Very good. And I know you're very busy, and then you're traveling soon. Is that right? Um,
Yes, I always travel, and I feel like this travel really enriches my life and my understanding of ancient cultures and practices.
mhm. Very good. And you are on the planning committee for the second conference. That's the science of Tai Chi and Qigong as whole person um, um, conference, and which is hosted by OSHA Center for Integrative Medicine and Harvard Medical School. And can you talk a little bit about this coming event and what the focus is going to be? And yeah,
So it is very exciting. We're still developing program, but we just finished a review of multiple abstracts that were submitted from a variety of practitioners, researchers, and clinicians. So it's going to be very exciting in Boston on April 30th, May 1st. I think the submissions are over, but certainly attendance is welcomed by those who are interested. The
yes,
theme is just to describe the best science, but there's actually quite a bit on aging and brain aging and dementia and brain health, where Tai Chi fits in, because there's a growing science around that issue, documenting the effects of Tai Chi on brain health and aging.
yes, and I believe that's one of the four themes is about the aging.
Yes.
Yeah, it's it's very good. So are you going to present yourself or yeah, um, like
Yes,
last time or?
I will be on a panel talking about mental health. We have published after the first conference, we published two parts, paper summary of the state of science on Tai Chi. And that was exhilarating because it was like with all the colleagues who were at the conference, but also transdisciplinary, various disciplines are involved. Primary care physicians, cardiologists, I'm a psychiatrist, neurologist, so it was very
Are you
enchanting
referring
to
to
have
the
all the.
white paper? The
Yes.
white paper? Yeah. So for everyone, if you're interested, uh, want to uh, learn more, and then you can go to that conference site, and I can put the link down there. And then there's one drop down, and then you can find out the white paper there. And it's very interesting, and it how should I say, organized very well. And if you look at some of the like a conclusion they make, you can click on that and then go to the how should I say, the the source of it, and then you can read the paper. And then if people they cannot fall asleep during the night, they definitely can read it. But it also depends on the individual. And for me, because I'm very interested in these studies, so I just keep reading and reading, and I cannot go to bed. And this is very good. And so. Dr. Lavretsky, do you have any words you want to share with us? And uh,
So, I think we're living in a very exciting time of uh, the science finally being able to demonstrate the value of Tai Chi practices for health and brain health. And I think the next big thing will be neuroscience of consciousness and how consciousness is transformed by these practices. So I'm looking forward to the future. There are a lot of young scientists who are coming to this field.
that sounds very fascinating and then very intriguing. Does that also kind of relates to so-called quantum physics or in that area? And uh,
Yes, I mean, quantum physics is what explains it. I think we're going to merge with that at some point, not yet though, but scientific methods are being developed so that we could capture changes in consciousness with the changes in the brain and due to these practices. So I'm very positive and I think it's going to happen sooner rather than later.
that's great. Okay. Well, thank you very much for sharing this information with us. And I know you're very busy, but thank you for making the time for us.
Thank you
Okay.
so much.